Prescription drugs are everywhere these days. Chances are someone in your family uses them. Americans currently spend around $200 billion a year on prescription drugs, and that amount is growing at about 12% a year. Drugs are the fastest growing part of the healthcare bill, which itself is rising. This increase in drug spending reflects the fact that people are taking a lot more drugs than they need to. Most of these drugs are for losing weight, depression, anxiety, migraines, insomnia, allergies, blood pressure, and the cost of all these drugs can be high. Prices of sleeping medications can range from $20 to $300 depending on the type and whether it's prescription or not. Common side effects include tolerance, where you need more of the drug for it to work, drug dependence, withdrawal, drowsiness, confusion, forgetfulness, drug interactions, which is when you use two drugs at the same time and the interaction between them can worsen present side effects, rebound insomnia, which is when you stop taking medication, insomnia worsens. Celery is a relatively low-costing food that can help you sleep. In addition to containing balanced minerals, vitamins, and nutrients, celery contains an oil that helps regulate the nervous system, which can help you sleep. It's also low on calories. 1 cup or 100 grams of celery has only 14 calories. The cost of celery is also low, ranging from about $2.50 to $10, depending on where you get it and how much of it you buy. There are also no side effects, as opposed to the many side effects from sleeping pills and other medications. It's delicious.
In 90 to 95% of high blood pressure cases, the cause of the increase in blood pressure is unknown. Factors that may lead to high blood pressure in the remaining 5 to 10% of cases, known as secondary hypertension, include kidney abnormality, structural abnormality of the aorta existing since birth, narrowing of certain arteries. High blood pressure leads to thinning of the insides of arteries and veins, leading to stroke, blindness, kidney failure, congestive heart failure, and angina, otherwise known as chest pain.
Some treatment medication for high blood pressure can cost as little as $35 a year, but other leading brands may cost up to $700, which is a lot. There's a simple way, however, to lower blood pressure, and that is to exercise. Just 30-60 minutes of exercise a week can lower your blood pressure dramatically. To further lower your blood pressure, you can eat more potassium-rich foods such as apricots, raisins, figs, bananas, stuff like that. Cutting back on alcohol, tobacco, caffeine, these things will also lower your blood pressure. It really doesn't matter what you do, running, swimming, rock climbing, it doesn't matter, just as long as you get outside, get some fresh air, get your heart pounding, lower your blood pressure.
A study of walking groups has shown that just increasing the distance you walk can really help your health. And they did a survey, and they studied 60 male patients from 61 to 80 years old who suffered from heart disease. And it showed that the patients that walked longer distances, they lived longer, and they showed improved health. So if you just spend more time outside and walk longer, then you can really increase your health and how you live. Research has shown that people who grow up with more allergens are less prone to have allergies when they're older. Like if you're a little kid and you go outside and play around in the dirt a lot, then you're more likely to not get allergies when you're older. And research has shown that when infants have been exposed to allergens such as milk, peanuts, or shellfish, that it'll actually boost their tolerance against those foods instead of tearing it down and making the allergy worse. And it's also been shown that children who grow up in a clean and sterile environment, they'll have more allergies and are prone to more sicknesses than people who grow up in dirty, more outside-y environments. And National Geographic did a survey and a study on this, and they showed that people who live on farms with like goats and animals and stuff, they will have better immune systems than people who live in a city environment.
For our survey, we interviewed 50 teenagers and 50 adults to see if early exposure to allergens helped build tolerance. We asked a series of questions concerning allergies the person had and whether or not they had spent time outside as a child. We theorized that if you spent more time outside as a child, then you'd have fewer allergies, and if you spent more time inside as a child, you'd have more allergies. Actually, it turned out there's no correlation between the two, and it actually had a reverse effect. 31 out of the 50 people we asked spent time outside as a child, but they had allergies. And only 12 out of the 50 people we interviewed spent time inside but didn't have allergies. The numbers were relatively similar in adult numbers. What we did find was that for the people with allergies, they admitted to having close relatives with similar allergies, and the people without allergies also had relatives with no allergies.
So in conclusion, we found that it is more health beneficial to live a more natural lifestyle than to take all these medications that have all these side effects. And we hope this was very educational and you have a nice day.